Hi, this is Dr. Jonathan Haverkampf. Thank you that you could join me today for another brief impromptu talk. The issue today will be anxiety and panic attacks. They are very, very common, and a lot of people do suffer from them. Probably the person sitting next to you on the bus, likelihood is high that that person also suffers from anxiety or even panic attacks. Now, before going on, I have to add this disclaimer that what I'm about to talk to you about today is just for academic discussion. It's not medical advice. So if you do suffer from a medical condition or from symptoms, either of mental health or somatic symptoms, you should consult a professional and talk about that. Now, having said that, let's look at anxiety and panic attacks. There are two things in general that can be done to help you. One thing is the psychotherapy and counseling, which is really geared towards a long-term solution or resolution of those problems. The other one is medication. Now we have two kinds of medication. One is for the anxiolytics, for example, benzodiazepines, which work for a couple of hours. However, they're not really meant to be taken regularly because you could develop tolerance, they can lose their effectiveness, and one can get dependent on them. On the medication side, a long-term solution or help for the problem are the SSIs. Those are antidepressants, which do work quite specifically also against anxiety and panic attacks. Of course, they also help against depression, and I also use for various other purposes. But I'm seeing how well they help again and again. They can take a couple of weeks, a month to kick in, but usually they work quite well. There are a couple of those drugs out there, SSRIs, and it depends a little bit on what your other symptoms are. For example, if you have sleeping problems, if depression is also an issue, which one to choose. It also depends on maybe you have other medical conditions or the other issues that impact which SSRI to use. Now, of course, medication always can have side effects, so you should discuss this with your doctor. Also, if you have any concerns about them or questions about them, you should always ask. They're usually very well tolerated. However, again, medication can have side effects, and it's always important to make sure that there are no particular risks or to taking medication, or also, for example, preconditions, and also to be aware of side effects. Now, on the psychotherapy and counseling side, there are a couple of approaches. There's, for example, CBT, cognitive behavioral therapy, which works by looking at more at the moment, the present. You're looking at cognitions, you're looking at behavior in the moment, and you work with that. The other therapy out there is the psychodynamic psychotherapy, which looks more at underlying issues, for example, emotional conflicts or past experiences, pretty much anything that can underlie the anxiety. So as you see, there's already a little bit of an overlap between psychodynamic psychotherapy and CBT. Of course, people from either school probably wouldn't see it this way because they like to stick to their perspective and view of things. However, I do feel that they both can be helpful in combination, and I also do use them both. Now, there's another therapy out there. For example, I mean, there are many psychotherapeutic approaches and counseling approaches out there. There's also communication-focused therapy. That's a form of therapy I developed, and I find is very helpful also when it comes to anxiety and panic attacks, as well as when it comes to other issues as well, other mental health issues. Panic attacks are really the kind of the tip of the iceberg, if you want, when it comes to anxiety. They are episodic, extreme feelings of anxiousness, but not just anxiousness. It's more a sense of impending doom, and people often feel, I mean, with heart palpitations, racing heart, and or people being afraid they could suffer a heart attack, or there could also be a shallow, rapid shallow breathing. People might even feel that they will suffocate or cannot breathe anymore. So it's essentially people are afraid for their life, and or that something really bad is going to happen to them within the next minutes, or just 10 or 15 minutes. Now, panic attacks usually go away quite quickly. So the medication, as I said before, which can, essentially, lower anxiety significantly or even stop it. The anxiolytics, which are often benzodiazepines, are used, like Xanax, which is alprazolam, or lorazepam. One brand name is Ativan. They can take a half an hour to work, or even longer. Now, often a panic attack is already gone by the time they work. However, it still can help people to have a tablet of an anxiolytic with them in their pocket, so they feel more secure and feel it's not gonna get that bad. There are, of course, many techniques on the psychotherapy side to deal with panic attacks, even including meditation, mindfulness. Mindfulness is researched quite a bit when it comes to panic attack, to anxiety in general, and many other techniques. In my experience, anxiety and panic attacks can really be dealt with quite well. I don't know if I've seen any case where it wasn't at least possible to lower them. But in many cases, they're really not an issue anymore. It can take a couple of months, or maybe even longer, but we have a lot of very effective tools, both the psychotherapy and medication side, to deal with them. Psychotherapy can often also be enough. So by itself, it doesn't, there's no absolute need for medication, maybe except for the most extreme cases. But medication can be a valuable support and get effects more quickly. It also can be a support to the therapeutic process, to the psychotherapy and counseling. So using them together is actually quite a good idea in many cases. But it depends on the individual, and that needs to be discussed with the therapist and the medical doctor who prescribes the medication. So in general, there's a lot that can be done to help. In many cases, it can also be on the psychological side to help someone, or to essentially develop the skill to not engage with the thoughts that that trigger the panic attacks, or with the anxiety and the anxiousness itself. It sounds maybe easier said than done, but over time people can practice and develop the skill to do that. It's like, when you're sitting at the train station and a train goes by, not getting on the train, and essentially just watching it go by can be very helpful over time to develop that skill. Often there can also be external reasons. There can be stressors, problems at work and in the relationship, which maybe even trigger or maintain the panic attack, or the anxiety and panic attacks. So in general, there's actually very often something where when people think about it, they feel something is out of sync in my life somewhere. Because anxiety is always about uncertainty, or at least a certain degree of uncertainty. Maybe not necessarily uncertainty about external events, but more also about an uncertainty about oneself, or kind of like one's own inner life, one's emotions. Like I could suddenly crash and feel very anxious, or emotionally very tense and nervous. And so there's a heightened alertness, or often also a hypervigilance. And of course that is not made easier when there's stress, when you're in a stressful situation at the workplace or in a relationship. So dealing with that is also important. There are actually three factors that play a role when it comes to anxiety and panic attacks. One is the biological side. There's a predisposition, at least we believe there is one, and in studies you can see there's a certain relation between genetic variations, or variations also in certain receptors in the brain, certain serotonin receptor subclasses, for example, that are highly correlated, or are correlated with anxiety, also with depression and other conditions. So there's a biological aspect. Can be a predisposition. It can run in families, but it doesn't mean one has to have it, and it doesn't mean it has to interfere with life. That's what we can do something about. That's where the psychological and the social side also comes in. The psychology, how do I deal with thoughts, negative thoughts, doubts, anxious thoughts, or in general with relationships with other people, communication. Do I communicate my emotions? Do I communicate how I feel, what I want, what I need? Do I get that? The ability to say no. In one's professional, but also personal, relationship life, with friends, socially. In all areas, it's important to have a sense of what do I want, what do I need, and to use communication with other people, interaction, to make that work. That helps, in my experience, very often when it comes to anxiety. On the social side, it also depends a lot on what's my work environment like, what's my relationship like, what are in general my relationships like. Am I under a lot of pressure in the workplace? Often the worst pressure is the pressure we put ourselves under, when we pile on ourselves, when we feel we have to reach certain goals or achieve certain things. There's nothing wrong with achievement, but when it's achieving for the sake of achieving, there's a risk, a real danger, that once you achieved something, you just have to look for the next thing. And that can keep the stress going. So, you see, there's quite a lot that can be done about anxiety and panic attacks. And this is just a snapshot a very tiny snapshot, a little bit of a little overview of some of the areas which can be relevant in dealing with that condition which really can interfere with your life. So, if you suffer from anxiety and panic attacks, I do hope that you will seek and get the help you need. And that is good for you, and that really does help you. Now, there's a lot out there, and I'm always also happy to answer any questions you might have. Thank you for being here today, and all the best to you.